Good afternoon, friends. Myself is Dr. Vinay. I'm a consultant psychiatrist currently practicing at Gurgaon. I'm associated with Emoneeds, which is a psychological well-being center. Today's that webinar topic is all about understanding sadness, depression, and anxiety. So let's we go and discuss how the sadness are different from the depression and how we can come to the conclusion whether we require a psychiatric consultation or a mental health consultation for this or not. And also we will discuss about the common anxiety issues and anxiety disorders. So let's we start uh, our presentation. So if we talk about the depression, there are symptoms of depression vary from person to person. But there are two key signs which are the main, we can say, major symptoms which are generally present when a person have the depression or symptom of depression. So these two signs are either they have the loss of interest in the things or the activities which they like to enjoy earlier in the past. And second thing is about the sadness or irritability. So if we talk about the loss of interest and things, like the person say that earlier he used to enjoy the activities like watching TV, talking with the friends, going out for the parties, watching, reading the newspapers, reading the books, doing the paintings. But now he or she don't have the interest in these activities. So this is a cardinal or a major symptoms. It can be a hint or indication for the depression. And second thing is the persistent and pervasive low mood or sadness. Persistent and pervasive means a low mood which remain throughout the day, and at least there is also as per the ICD-10 criteria. If we talk about for how long a person should feel low mood or decreased interest in activity, so it mentions specifically that at least for more than 2 weeks, if a person experiencing the decreased interest in the activities or persistent and pervasive low mood, then it can be uh, that person should go and evaluate for the depression from a mental health professional. If we talk about the what are the additional signs in the depression, so there are the feeling of emptiness, irritability to enjoy anything, inability to enjoy anything, hopelessness, lack of sexual desires, loss of warm feeling for family or friends, feeling of self blame or guilt, loss of self esteem, and there is crying spells, sadness, or irritability. So these are the additional signs in which these also can be the symptoms if the person have the depression. So how many symptoms out of these decides whether the patient is having the mild, moderate, or severe depression as per the ICD-10 criteria. If the person is having, you can say, major symptoms, which I mentioned earlier, two major symptoms and two minor symptoms, then and at least for 2 weeks, then it will be categorized as a mild depression. If the persons have the two major symptoms and the three three minor symptoms, then it will be a moderate depression. And if the patient having the major symptom plus may four plus more than four minor symptoms, then it can be categorized as a severe depression. And these symptoms should persist for at least 2 weeks. There are also change in the behavior and attitudes, which may include general slowing down, neglect of responsibilities and appearance. Patient feel confused, he not able to focus. There is difficulty to concentrate, like during the driving or during the work. He not able to concentrate properly. as he used to do earlier. And also there are social thoughts, feelings, or behaviors, and patient feels difficult in making the decisions. So these are the changes which appears in behavior and attitude of persons who feel depressed. If we talk about the physical complaints, so these may be manifest in form of sleep disturbance, such as early morning awakening, or sometimes patient feels too much sleepy. So the sleep disturbance either can be in form of this totally sleep disturbance, patient not able to get sound sleep, or sometimes patient sleeps too much. So sleep disturbance will be key cardinal features in the depression. There are also lack of energy, lack of appetite, which lead to the weight loss. Sometimes there is a increased appetite even. So patient starts having junk food, which lead to the weight gain also. There can be unexplained headaches and body symptoms, and the change in the bowel habits. So these are the physical complaints generally a patient feels during the depression. So now we back to the topic. What is difference between sadness and depression? So I will say a major difference between both of them is one of the degree to the extent a person experiences his or her symptoms, and to the extent to which these symptoms impair their life. So in the sadness, a person feels sad for some things happen in the past, but still they able to, you can say, manage their daily activities. They able to do their daily living activities. Somehow they able to manage their works, but feels depressed, so he not able to perform those uh, daily activities, and there is lack of energy and impaired biological functions. These are the characteristic of depressions. So if I'm talking about the biological functions, so these are the our sleep, appetite, and the sexual drive, which is the which is get affected in the depression. But most of the case of simple sadness, these biological functions not get affected. So if I say how does clinical depression differ from the sadness, beyond the 2 week qualification, which I mentioned that there should be at least 2 week uh, duration for the symptoms to persist before we classify as sadness or depression. So sad person might also feel a lack of energy or feel important in the face of life's demands. In the sadness, they might equally suffer a diminished capacity to think or feel guilt about their current state. If you talk about specifically depressed, so depression individual find himself caught in recurring self-diminishing negative thoughts, patterns, guilt and shame. And sometimes in extreme of these cases, the negative thoughts patterns can lead to thought of self-harm, suicidal ideations, or going as far as to have a suicidal plan. So again, if you want to summarize, so some sadness and depressions, basically sadness are, you can say, for the short period of time, which not lead to the affects our day-to-day activities or work. But when the sadness persists for more than 2 weeks, and which lead to the significant deteriorations in our daily living activities, and there are distinctly which affecting our biological functions, which include sleep, appetite, and our sexual drive, then the sadness can be the depression, and it need to be evaluated by some mental professionals. So if I just talk about the briefly what causes the depression, so definitely depressions, and they have the tendency to run the families because having genetical correlations. So if the persons whose parents or sibling having the depression, so there may be high chance of him or herself to get depression in the lifetime. So there are some neurohormones which play the roles uh, in the leading to these kind of symptoms. These include serotonin, dopamine, Not epinephrine. These are some neurochemicals, neurohormones, which are the uh, key contributors for our mood state. So it has been found in the various scientific studies that these hormones get affected in the brain, which lead to the generation of these symptoms. Most of the people thinks that depression only occurs when there is stress in the environment. So, but sometimes we get the patients who don't have the stress in the environment, but still they feel depressed. So it hints that because of the neurohormonal disturbance, these people getting depressive symptoms. So with the medication and with the proper counseling services, these patients get improved. Uh, yes, positive or negative life events can trigger the depressions, but they not lead to the depression. Like if a person's who having the neurohormonal disbalance and simultaneously if he has to go through the death of a loved ones, so these can be a triggering agent to which can lead to the depression. Sometimes some major illnesses which due to the disabilities like cardiac issues or stroke or paralysis, cancer, these also may lead to the depressive symptoms. Certain medications, uh, the persons who take the medication for long times, like lots of people who having the epilepsy, so they take the medicine for the long time. Sometimes medication even lead to the depressive symptoms. Use of alcohol and other drugs also lead to the person the depression. Sometimes there is no any reason which can be directly contributing to the depression, but still depressions occur. So if we talk about the types of depressions, so there can be the syndromal depressions, which I mentioned, can be form of mild, moderate, severe depression. There can be dysthymia. There is one another category of mood dysregulation. It is called as bipolar disorder. I will just tell you briefly about this. And there is a seasonal affective disorders. So major depressions, I mentioned that this type cause symptoms based improve suddenly possibly triggered by loss, crisis stages, and these lead to the interfere in the normal functionings. And these episodes sometimes lead to the suicidal tendencies and persons take the extreme of steps before, and in spite of consulting to a mental health professional. So these kind of patients require close supervision by the family members and the professionals because they can anytime, any point of time, they can attempt for suicide. So they need a 24-hour supervision. Dysthymia is a kind of depressions. So these are not. I mentioned that people should have the mild moderate severe depression, but person with dysthymia have the illness which are mildly depressed for years. They function very fairly well on daily basis, but their relationships suffer over time because of this dysthymia. So you can say a persistent low grade or low mood can be categorized as a dysthymia. Bipolar disorder is kind of mood dysregulation in which the person's mood fluctuate from the one pole to another pole. So, like there are some episodes in which patient feel the depressed. I mentioned the symptom depressions, but sometimes there are the episodes in which patients uh, switch to the higher side of the mood, in which patients become over talkative, over you can say irritable. There is a overconfident. There is a decreased need for sleeps. There are racing of thoughts in their mind. So it is just exactly opposite to the depression. So in the depression, where the patient feels dull, depressed, but in the mania or hypomania, patients feels elated, excited, overconfident, over cheerful. So the patient's moods fluctuates from one pole to another pole. So then this is called bipolar depression, which require medication and the counseling for the treatment. There are also seasonal affective disorders in which the persons feel change in the mood whenever there is some seasonal changes. Mostly in the winters, people feel depressed as compared to the summer times. So the professional treatment necessary for all these type of depressions. Emoneeds and such kind of organizations are exclusively are for such kind of providing the mental health services people who feel depressed and not able to perform their daily routine activities. If we talk about treatment in the depression, there are the medications which help persons to get their mood stable. ठीक है? Some people think that antidepressants are the habit formings, but it's not like always. Depression's medicines generally, as per the guidelines, 4 to 6 months of treatments is minimum it requires. Sometimes we have to extend the treatment for 1 year and then we gradually taper it off. So these are absolutely safe medications, and these medicines help to regain their confidence to manage their personal and professional life. Same way as psychotherapies, counseling therapies are also very plays a major role in the recovery of the depression. There are one-to-one counseling with the counselors, with the patients, and these counselors do the various form of therapies and counseling, which includes supportive therapies, cognitive behavior therapies, interpersonal therapies, which help the patients to overcome the depressions. So, if you know someone, if you or someone who you know has symptom depressions, so there should be a need to take the actions. There should not be any shame or uh, hesitation if we are consulting to mental health professionals. Uh, they should meet a doctor for the complete health checkup, or they can go to the counseling centers like Emoneed. So definitely, proper evaluations can help persons to restore his daily activities. They must talk with their friends, family, or members about their sufferings, because these symptoms are not like physical symptoms. If a person get fever, if a person get cough, so these are the visible symptoms. But symptoms of depression or mental health symptoms are not visible. These symptoms you just only feel. So until unless you will not tell to the other person that what are you feeling right now, so they will not able to understand uh, what you're going through. So you definitely discuss with your close one, your friends, family about these symptoms. Uh, if you talk about how what we can do to prevent ourselves to land up into depressions, we should definitely maintain our personal and professional life balance. We should take the break. Sometimes people keep working 24 into 7. So, as the work is an important part of life, same way the break is also very much necessary, which fills up with the energies to do the work for longer time. We have to do some exercise on daily basis, and definitely having the quality foods or nutritious food as compared to the junk food, which can prevent us from depression. We should also avoid alcohol takes and other kind of addiction behavior we should avoid. We want to stay away from the depression. And yes, these are the some things which we can do to prevent ourselves um, to land up in depression. Sleep also play a major role. We should not ignore or take our sleep as granted. We should at least take a 7 to 8 hours of sound sleep, which is definitely a must for the stable mental health of a person. So these are the things which persons can do. Uh, there are lots of things which the psychologist or the counselor tells people to avoid, uh, like if the person is having depression. So these are generally depend vary from person to person. So generally during one-to-one counselings, psychologists teach them some ways or some techniques from which uh, they can come out of the depression. So these are the some brief points for the depressions. We discuss about the anxiety disorders. So because anxiety is also a very common condition. Anxiety Disorders are of several types, which include general anxiety disorders, agoraphobia, obsessive compulsive disorder, phobias, panic disorder, and post-traumatic stress disorders. So, if we talk about what is the anxiety, so it is a feeling of overwhelming fear, anxiety, worry, and there is no obvious reason for these feelings. So, this anxiety can become worse if we not take the treatment, and sometimes these anxiety symptoms are associated with sweating, palpitation, gastric upsets, dizziness. People feel different kind of symptoms. So generally, the anxiety a normal physiological response. Basically, anxiety generates whenever we perceive a danger or threat. Suppose if we get the earthquake, so we get anxiety, and this anxiety will help us to go to some safe place. But when this anxiety occurs without any obvious threat or obvious danger, and sometimes it becomes so intense and so disabling that persons not able to perform their daily activities, then it will become a disorder. If we talk about generalized anxiety disorder, these can be uncontrolled worrying about everyday things like their health, their money, their family work. So throughout the day, they feel anxious, and also they feel the trembling, sometimes muscular aches, sometimes sleep difficulty, irritability. So these are additional symptoms patients in the generalized anxiety disorders generally feels. Uh, OCD is also a kind of anxiety disorders. There are recurring thoughts or obsessions, and which reflect exaggerated worry or fears. Like during the time of COVID, uh, generally people who having the fear of contamination, they 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 continue to wash their hands for long times. But uh, some people, even after the COVID is over, so they having significant fear of these contaminations. They spend a lot of time in washing their hands, lots of times taking bath. So these obsessions becomes too much interfering in our day-to-day life. Obsession and compulsions are can be another form of also. There is not only the fear of just contamination. There are other things also like a person's there is repetitive checkings whenever they go outside their home. They keep checking their locks whether they lock the door properly or not. And sometimes obsessions it can be in form of those peoples uh, who were very religious, so they get the repetitive thoughts against the idol's image. So these thoughts are very intrusive. Intrusive means like they not want these thoughts to occur, but these keep on coming and they generate the anxiety. So this way, the OCD affects the people. There are some phobias. There are intense something disabling fears, and generally cause of fear poses little or no actual danger. Like some people have the social phobia whenever uh, they have to they fear of contact with crowds or situations. Uh, some people have aerophobia, they have fear of flying, so they avoid going to flights. Or there are lots of type of phobia like claustrophobia. Claustrophobia basically like a fear of closed space, so they avoid taking the lifts. And carcinophobia, fear of cancer, fear of thunderstorms. It's called the brontophobia. There are different kind of phobias which are quite common in the general populations. Next is the panic disorder, which is a feeling of terror that strikes us suddenly and repeatedly with no warnings. So they're not able to predict when the next attack will occur, which lead to the more anxiety. So they feel the intense anxiety, and there is a fear of dying, fear of losing control. So then it is called a panic attack or panic disorders. Then one more anxiety disorder is post-traumatic stress disorder. This is a psychological reaction that occur after experiencing a highly stressing event like physical violence or some wartime combat or some natural disasters like flood. So, like those people who have experienced these uh, committees, so they generally get anxiety in the future also. So, again, the treatments include both medication and the counseling therapy. Uh, so, definitely, if the persons, those who feeling that they having the persistent low mood and decreased interest in activities for more than 2 or 3 weeks, and or the persons who having the intense anxiety, and these are anxiety, these symptoms interfering in their day-to-day personal and professional lives, then these symptoms definitely should be evaluated by some mental health professionals. They can go to the organizations like Emoneed or some other nearby mental health professionals. If the persons are sitting far away from the centers, so they can definitely contact online uh, to know or to evaluate for these symptoms. And if they diagnose for these symptoms, definitely they should uh, get proper treatment, which include medications and the counseling services. So, in this way, we will able to manage these conditions. So that's the part from my sides. If there is any comment or any contribution to this presentation, so I welcome. So I think there is no any comments. So uh, thank you guys whoever joined this presentation, and hope it was helpful for understanding the anxiety depressions. Thank you so much.